Welcome back to another episode of Coach's Corner with Dr. Joseph Munoz this week. Today, I want to talk to you guys about the importance of exercise for regulating glycemic control, particularly in individuals who may be overweight or diabetic. We know that weight loss is associated with an improvement in glycemic control. When I say glycemic control, I'm talking about insulin sensitivity, blood glucose concentrations, and the saturation of hemoglobin A1C. These are all measures used in a clinical setting to tell us either how insulin sensitive or insulin resistant somebody is and whether or not they have conditions like pre or type 2 diabetes. So like I mentioned, today we're going to talk about why it's imperative to do exercise to improve this condition. First, we should talk a little bit about insulin and the role of insulin. There's a lot of misconceptions about insulin. The main role of insulin is to take blood glucose and move it into some tissues, for example, the muscle, the liver, or adipose tissue, okay? So glucose can be used by different tissues depending on the metabolic state of the individual. So you eat some carbohydrate, it gets broken down into glucose in your stomach and the intestine, and then it goes into the bloodstream, and once it's in the bloodstream, it needs to be taken up by different tissues. Again, those tissues can be the muscle, can be the kidneys, can be the liver, different organs. They use glucose for energy, okay? The way insulin actually works is that it binds to an insulin receptor on the cells of the tissue that it's going to exert its function on. So let's talk about muscle, for example. Insulin binds to the insulin receptor on muscle cells, which causes certain mechanisms to initiate inside the cell. One of those mechanisms involves the translocation, that just means movement, of a protein known as GLUT4 to the membrane of the cell. Okay, so it moves from the inside of the cell to the outside of the cell. The movement of GLUT4 from the inside to the outside of the cell now allows glucose to enter the cell because GLUT4 is a transporter for glucose. Okay, it literally stands for glucose transporter 4. So you can think of this GLUT4 protein almost like a door. Okay, so imagine, this is going to be kind of a weird analogy, but imagine a wall that's completely closed off. Insulin is like a construction worker who's going to come and build a door. And now once that door is there, aka GLUT4, that door can open and glucose can come into the cell. What happens when we have insulin resistance? The mechanism of insulin resistance is vast, okay? Insulin comes from the pancreas, particularly from cells known as beta cells. So there could be a dysfunction in the beta cell, aka it doesn't produce insulin properly, or there's some sort of issue with the beta cell itself. There can be issues with insulin signaling, so insulin binding to the insulin receptor. There can be certain issues there that cause insulin resistance. So if it's not binding as well as it should be, that's a contributor to insulin resistance. And there can be issues with the mechanisms that actually occur inside the cell for the GLUT4 to translocate to the cell membrane. So there's various different areas where insulin resistance or different areas or mechanisms that it can occur that can contribute to insulin resistance, okay? And like I mentioned at the beginning, we know that losing weight in general improves insulin resistance. However, it's not just about losing weight. Exercise can have an independent beneficial effect for improving insulin resistance. So one of the main contributors to insulin resistance is the production of molecules known as cytokines by our adipose tissue, by our fat cells. When we have additional fat, particularly when we are overweight or obese, certain fatty depots are going to produce a higher amount of these molecules known as cytokines. Now, there are different classes of cytokines. One particular class are pro-inflammatory cytokines. Pro means for, and inflammatory means inflammation, obviously, so they cause inflammation. Some of these molecules have names like TNF alpha, IL, so IL stands for interleukin, IL-6, IL-1 beta. These molecules all inhibit the action of insulin, okay? Mechanistically, when they are produced in higher quantities, it causes insulin not to work properly. So when we exercise, we know that one of the chronic adaptations of exercise is a decrease in inflammation, in chronic inflammation. So that should result in lower production of these pro-inflammatory molecules that I'm talking about, which should result in improved insulin sensitivity. So exercise has been shown to improve beta cell function, to improve insulin signaling, which ultimately results in better glycemic control. Okay, there's data showing that individuals who do resistance training in particular have a lower risk of type 2 diabetes, even when controlling for weight change and aerobic exercise. So, as I've mentioned now, exercise has a direct effect on improving insulin signaling. However, aside from that, exercise has a beneficial effect on glycemic control independent of the actions of insulin. I was actually talking about this on a post a couple days back, or maybe a couple weeks back by the time you guys see this video, but muscle contraction induces glucose uptake independent of insulin. So if you guys remember a couple minutes ago, I was talking about how insulin works. It needs to bind to the cell, and then it translocates that GLUT4 protein to the outside of the cell. The reason we need insulin is to move that GLUT4 from the inside to the cell membrane. However, muscle contraction does the same exact thing without the requirement of insulin. So it's an insulin-independent mechanism. So essentially, when a muscle contracts, and it doesn't have to be from resistance training, it can be from walking, aerobic exercises. Remember, any type of movement requires muscle contraction. The contraction of the muscle itself induces certain mechanoreceptors, which are receptors on the cell that respond to a mechanical stimulus, such as a muscle contraction. And that also induces certain mechanisms inside of the cell, which cause the translocation of the GLUT4 protein to the cell membrane. Okay, I think this is extremely interesting, and it's one of the overlooked aspects of how exercise can improve glycemic control. Sure, the benefits on insulin are great, but the fact that contraction of muscle can increase glucose uptake without the effects of insulin in an insulin-independent mechanism is also incredible in my opinion. So, for those of you that have been diagnosed as quote-unquote pre-diabetic or have type 2 diabetes or are overweight and obese and have a certain degree of insulin resistance, yes, having a healthier diet, reducing your caloric intake, and losing weight will help your glycemic control. However, if you exercise and participate in both aerobic and resistance training, those improvements should theoretically be greater than just weight loss on its own via a dietary intervention. So don't shy away from exercise. Make sure you get your steps in every day. Make sure you go for walks. Make sure you're lifting weights, even though you're not trying to be a bodybuilder. Lifting weights has many benefits outside of just building muscle mass, although muscle mass is a major contributor to health. And again, one of those improvements, or one of those benefits is improved insulin sensitivity and improved insulin signaling. With that being said, thank you all for listening, and I'll catch you guys next time on Coach's Corner. See ya.